chest X-ray, endoscopy with biopsy, stool for quick and esophageal manometry. So the primary role of both chest radiography and computed tomography is initial identification of the hernia, either incidentally or in the acute setting. For adequate radiologic evaluation of hiatal hernia, the primary study is a barium swell because it identifies the anatomy of the hernia, the relative orientation of the hernia contents, and localize the gastroesophageal junction. In addition, this study is conducted in real time, so it allows the radiography to identify the anatomy as it relates to other key structures and how these essential elements interact. For paraesophageal hernias, the imaging and diagnosis is fairly straightforward, whereas and diagnosis of type 1 hiatal hernias can be more difficult. Because of variations of protocol and radiographic criteria for defining hiatal hernias, there can be significant differences in interpretation of barium swells. In order to visualize the key structures, they have to be distant, which intrinsically changes their relative positions. These destinations causes shortening of the esophagus and displacement of the esophageal gastric junction, which is the basis of the 2 centimeters rule. The 2 centimeters rule states that there must be more than 2 centimeters between the diaphragmatic hiatus and the squamous junction for diagnosis of type 1 hiatal hernia. Without visualization of the V-ring, 3 regular folds above the diaphragm are necessary for diagnosis.